Hi friends, welcome to Nursing Achievers. I think now everyone is preparing for upcoming CRE and NORCET examination. If yes, then watch this video till end. In this video, I will explain a best study plan to crack this examination very effectively. This video will explain the most high yield topics for the exam which were frequently asked in all NORCET series. These topics were formulated based on thorough analysis of all series of exam. In this video, it only mentions the topic names to prepare. But from our next videos, we will discuss each topic thoroughly and we will master over it. So let us see the topics. The first most important topic which are frequently asked in NORCET is cardiopulmonary resuscitation, CPR. CPR means we all know cardiopulmonary resuscitation. It is an emergency life-saving procedure performed when the heart stops beating. The most important frequently asked questions in NORCET are BLS guidelines. BLS means basic life support. In that, they mainly focus on compression to ventilation ratio, compression depth, compression rate, and the hand placement. Compression to ventilation ratio, in that also, it mainly focus on for adults. In adults, single or two rescuers, the compression to ventilation ratio. Actually, that is 30:2. And for children and infant, for single rescuer, it is 30:2. And for two rescuers, it is 15:2. Coming to compression depth, in adults and children, the compression depth is about 2 inches. And in centimeters, it is about 5 centimeters. In infants, it is about 1.5 inches. Next, compression rate. The rate is about 100 to 120 compressions per minute. Hand placement. For children and adult, the hand placement should be in the center of the chest. Means that is near to lower half of the sternum. In infant, the hand placement is not there. Only we will use the 2 fingers in case of the single rescuer. In case of 2 rescuers, it is about 2 thumbs. So these are the main questions frequently asked in CPR and that too in the BLS. Coming to next one is ACLS, means Advanced Cardiac Life Support. In that, they will mainly focus on how to use the automated external defibrillator and what are the types of shock. In that we have the 2 types of shock, shockable rhythm and the non-shockable rhythm. Shockable rhythm means examples, ventricular fibrillation, ventricular tachycardia. In the non-shockable rhythm, examples are asystole, pulseless electrical activity. And coming to next point, when we will administer the epinephrine and what are the doses regarding epinephrine. And they also ask the questions regarding what are the difference between infant and pediatric CPR. Yes, there is a difference between infant and the pediatric CPR regarding compression techniques. In case of single means we will use the 2 fingers. In case of the 2 rescuers, we will use the thumb. And also pulse check location is also different in the infants and the children. In infant, we will use the brachial artery. In children, we will use the carotid or the femoral. Next important topic is high quality CPR components. What are the components in the CPR? Means minimizing the interruptions in compressions, that is less than 10 seconds, full chest recoil after each compression, and effective rescue breathing. These are the most important types of questions frequently asked in the topic of CPR. In the CPR, they mainly focus on the BLS, ACLS, and what are the difference between the infant and pediatric CPR techniques, and what are the components in the high quality CPR. So you have to thorough about the CPR content, means you will get surely one question and you will get 1 mark. Next, coming to the another topic is endotracheal tube and its sizes, depth of insertion, formulas, and the color coding. We all know endotracheal means, endo means inside, that we call it as a procedure known as the intubation. Intubation means the process of insertion of the endotracheal tube. Endotracheal tube means it is a flexible tube inserted through mouth or nose into the trachea in order to maintain the airway patency and to provide the mechanical ventilation and to ensure the adequate oxygenation. So this is about the endotracheal tube, and the process of insertion is known as the intubation. In this topic, the most frequently asked questions related to the indications. What are the indications of the endotracheal tube insertion? What are the indications? Generally, respiratory arrest. In case of trauma, in case of burns, any emergencies, we will do the intubation. And they also focus on the steps of ET tube intubation. What are the steps? First, we have to prepare the equipment. Before equipment preparation, we will check whether the equipment is working or not. So ET ATT, laryngoscope, suction, oxygen, everything we have to check. And second one, most important is pre-oxygenation. So many questions are belonging to this point only. Pre-oxygenation. We have to give 100% oxygenation for 3 to 5 minutes before the intubation procedure. Okay. Next, after the intubation procedure, we have to check the placement, whether the endotracheal tube is correctly placed or not. How we will confirm the placement? By auscultation of bilateral lung sounds, and we have to check for the chest rise, and the most golden standard is capnography. We have to check for the end tidal CO2 detection. After that, we have to give the post intubation care. So this is about the endotracheal tube intubation procedures. Coming to the sizes and the placement, the tube size is different. So many sizes are there. In the adults, we have to take about the males and females separately. For adult male, it is about 8 to 9 mm, and in the females, it is about 7.5 to 8 mm. In the neonate, it is based upon the weight. For example, if the baby is less than 1 kg, we have to use the 2.5 mm endotracheal tube. For 3 to 4 kgs, we will use 3.5 mm AT tube for the intubation procedure. So many different sizes are available, and we have to know about the different types of color codings. Coming to depth of insertion, so we have to know about the depth also. In adults, it is about 19 to 24 centimeters from the lips, and in the neonate, it is based upon the weight. Weight based formula is there. Age by 2 plus 12 centimeters. So we have to measure the depth of the insertion also. We have to check. And coming to the formulas. Formula means for the children, for the adults, we have to know the formulas related to the endotracheal tube intubation insertion, and we have to know about the complications. In that complication, two types are there. What are the two types? Immediate complications, late complications. Immediate means immediately if we place, its displacement means misplacement, hypoxia, aspiration, bradycardia. In the late complications, we have to check for the ventricular associated pneumonia, tracheal stenosis. So in that, we have to know each and every point related to the endotracheal tube and its sizes, depth of insertion, formulas, and the color codings. And we also know about the extubation. What do you mean by extubation? Extubation means removal of the tube. Before the removal of the endotracheal tube, we also have to process. We also follow some criteria. Means whether the patient is able to maintain the adequate spontaneous breathing or not. Before the extubation, we have to follow the some steps. That is, suction the airway, deflate the cuff, remove the tube during the inspiration only. So we have to follow each and every step, and we have to follow the extubation procedure. So this is about the endotracheal tube. Next one is suction catheter. So many questions are asking also from the suction catheter and its sizes, formulas, and the pressure during the suctioning procedure, and the equipment needed for the suction. Suction catheter. Suction catheter means it is a flexible tube used to remove secretions, mucus, and fluids from the airway of patient to maintain a clear airway and prevent the aspiration. And what are the uses? It is mainly used in the nasopharyngeal suctioning, tracheostomy, and endotracheal suctioning. From this topic, they mainly focus on what are the types of suction catheter. So there are so many types of catheters nowadays we are using in the ICUs. What are that one? Open type, closed type, anchor suction, whistle type. Open suction catheter means it is a single disposable use. Closed suction means it is a multi-use. Anchor means it is only used for the oral suctioning. So what are the uses? What are the indications to use the suction catheter is if the patient is having a pool of secretions and the retained secretions, SpO2 is dropping, audible or the visible secretions are there, then we will follow the suctioning procedure. In suctioning procedure also, we have to follow some guidelines. Before the suctioning procedure, we have to pre-oxygenate the patient with 100% of oxygen for 30 to 60 seconds. In ET tube, we have to pre-oxygenate for 3 to 5 minutes. But in suctioning, we have to pre-oxygenate it for 30 to 60 seconds. And we have to select the proper catheter size. The catheter size should not exceed half the internal diameter of the 80 tube. So we have to select properly based on the 80 tube in a diameter, and we have to insert the catheter without the suction and apply the intermittent suction. For application, rotate the catheter while withdrawing. The entire suctioning procedure should not more than 15 seconds. So we have to use the proper suctioning guidelines for doing this procedure. And catheter size selection. For this selection also, we are having some formulas. The formula is based on the endotracheal tube diameter in an internal diameter, ATT size into 2. For example, if we are taking the ATT tube 6 mm means the suction catheter size should be 10. How means 6 into 2, 12. Then we have to choose the next smaller size. Next smaller size is actually we got the value is 12, but next smaller is 10. So only we have to take the next smaller size based on this formula is only. Some other formulas are there. In that again the calculation will be different. But if you choose this formula, means the formula is ATT size into 2. For example, 7 mm ATT tube means 7 into 2, 14. But we have to took the next smaller size, that is 12 French. In case of 8 mm, the suction catheter size should be 8 into 6, 16. Minus 2 is 14. So based on the ATT internal diameter only, we have to choose the suction catheter size. And we also follow the suctioning pressure. This pressure is also different from the neonates, children and the adult. In case of neonate, we have to apply a pressure of 60 to 80 mmHg. In case of children, we have to use 80 to 100 mmHg pressure. In case of adults, it is about 80 to 120. So based on the guidelines only we have to follow while choosing and while doing the procedure. So this is about the suction catheter. Next topic is cricoid pressure. Cricoid pressure is also known as Telix maneuver. It is a technique where manual pressure is applied to the cricoid cartilage to compress the esophagus to prevent the aspiration. It is mainly used in the intubation procedure. Why means in order to prevent the aspiration and the regurgitation. So what is the purpose? We already know. That is mainly used for the intubation procedure. And from this, the most important questions related to correct application. What is the correct position and who will perform this cricoid pressure? Means who will perform? An assistant during the intubation procedure will perform. And what is the position? Position means we have to place the patient in a sniffing position. And we have to know about the pressure related to the cricoid pressure. Pressure means initially we have to apply 1 kg force or 10 newtons before unconscious. Before the patient is going to the unconscious, we have to apply pressure of 10 newtons or 1 kg, and it will be increased to 30 to 40. That means 3 to 4 kgs after unconsciousness. Okay, this is about the pressure. And some questions also they will ask about what are the difference between cricoid pressure and the birth maneuver. Cricoid pressure is mainly it will apply the manual pressure to the cricoid cartilage. In birth, it will apply pressure to the thyroid cartilage in order to improve the glottic visualization. For visualization purpose, birth procedure or the birth maneuver will be used. For intubation procedure, we will use the cricoid pressure. Next, coming to the important topic is order of blood draw. In every NORCET series of examinations, we will have this type of one question will be there. Order of blood draw means it refers to the specific sequence in which blood collection tubes should be filled during any puncture to prevent the cross contamination of additives. So we have to know about the correct order of draw according to the CLSI guidelines. First draw is blood culture. In the blood culture, we have the additive means added to is sodium polyethanol, and second we have to draw is coagulation test means the additive is sodium citrate, and next one is red means serum. There is no additive. And next we have to take the sample for gold or SST. SST means serum separator tube. And next one light green. Light green is heparin or lithium additive will be there. D means dark green tube. In that it will contains the sodium fluoride or the potassium oxalate. In that one mnemonic will be there. First we have to draw the blood culture. Second one is coagulation profile like that is there. Na? So the most mnemonic is boys love roses means B means blood culture, L means lavender color, R means red color. Then girls love girls like dairy milk. So G means gold or SST. L means light green, means heparin. T means dark green, and grow green, and another one is dark green also will be there. So we have to know about the correct order of blood draw. Next important topic is needles and its gauge. What do you mean by needle? A needle is a slender hollow metal tube with a sharp tip used to puncture the skin or tissues. It is mainly for the medication procedures. In this, so many types of needles will be there. Coming to the types, there are so many types are there. First one is hypodermic needles, Vacutainer or blood collection needles, butterfly needles, spinal needles, epidural needles, bone marrow needles. The hypodermic needle, the gauge range from the 18 to 27. For blood collection, the needle gauge is about 20 to 22 gauge. For butterfly, it is mainly used for the small vein puncture. The gauge size is about 21 to 25 gauge. For spinal needles, mainly for the lumbar puncture, it is about 22 to 27. For epidural means for anesthesia purpose, the type of needle gauge we will use is 16 to 18. For bone marrow aspiration, we will use 11 to 15. Next, in that also, we have to know about the gauge and its length. Higher the number, the thinner the needle and lesser the pain. Okay. So, when we consider the most highest is 25. 25 gauge is thinner than the 18 gauge needle. Okay. And we also have to know about the angle of insertion of the needle. While giving the intradermal injection, we will use the angle is 10 to 15 degrees. In case of subcutaneous, it is about 45. In case of IM means intramuscular injection, we will use 90 degrees. In intravenous, we will use 25 degrees of angle of insertion. So this is all regarding about the needle gauge and the length. And we also have to know about needle stick injury. If anything needle stick injury is there, immediately we have to wash with the soap and water under running water. Immediately we have to report to our HSI department and we have to take the prophylactic treatment. Post prophylactic exposure treatment also we have to know and we have to take. This is about the needles. Next one, Vacutainers. We already know about the order of draw of blood. Next coming to the Vacutainers. There are so many type of Vacutainers. Vacutainers means actually these are the blood collection containers. In that already additives will be there, and what are the based on the additives we have to use for the different type of the test. For example, when you see the red color here, no anticoagulant will be there, and it is mainly used for the serological examinations or biochemistry analysis we will do. In case of the gray color container Vacutainer, we will use the additive is sodium fluoride. It is mainly for the glucose estimation. In case of EDTA, it is mainly for the hematological examination, means complete hemogram we have to use. And in case of sodium citrate Vacutainer, means a light blue color, it is mainly used for the coagulation studies like PT, APTT. And green color Vacutainer mainly used for the bone marrow studies. Yellow color Vacutainer mainly used for the citrate, means citrate, and sometimes it also will be used for the immunological also sometimes they are using. So this is all about the Vacutainers, and type of additives also we have to know. Next one is blood groups and the related images. Blood groups. We all know about our blood groups. Mainly blood groups are classified based on the presence or absence of specific antigens, means antigens A and B on our red blood cells, and antibodies means anti-A antibody, anti-B antibodies in our plasma. So based on these specific antigens and specific antibodies, our blood groups will be classified. So here we have to know about the ABO blood group system, RH factor, blood group compatibility for transfusions, hemolytic disease of newborn and RH incompatibility, blood group testing, blood donation guidelines, how to store the blood and how to handle the blood. Like that, every topic we have to know before the examination, because these are the most important questions frequently they are focusing. So we have to know before examination, means we will easily get the marks. Next one, normal and abnormal blood values. We already know what are the normal CBP, RFT means renal function test, complete blood group, liver function test, thyroid function test. Everything we have to know about the normal values, and abnormal values also we have to know. Next, electrolyte imbalances and the corrections. What do you mean by electrolytes? Electrolytes means these are the charged minerals in our body that mainly help to maintain the fluid balance, nerve function, muscle contraction, and acid base balance. Main electrodes in our body are sodium, potassium, calcium, magnesium, chloride, bicarbonate, and phosphate. So we have to know about each about normal ranges and their functions. What are the key symptoms when it is hypo or hyper, and what are the causes and what are the treatment needed for the correction. So we have to know about this topic importantly. Next coming to the next topic, types of fluid and its calculations, images, and management for overload. Fluid overload. Here we know about fluid management. Fluid management means it refers to the regulation of the body fluid to maintain the homeostasis, electrolyte balance, and adequate perfusion. In that, we are having the different types of fluid. The easy mnemonic to remember type of fluids are CHIP. CHIP means CHIP. C means crystalloids, H means hypertonic, I means isotonic, then P means plasma expanders. Coming to here, what are the types of examples also they will ask. For example, isotonic solutions. Isotonic fluids are normal saline and RL. We mainly use it for the surgery and fluid resuscitation we will use. These belonging to the isotonic. Coming to the hypotonic, in that the osmolarity is lower than the blood. It includes 0.45% half NS. We will call it as half NS. No? Half NS is hypernatremia. Coming to hypertonic, it mainly includes 3% NS, 5% NS. Uses. It mainly used in the severe hyponatremia or cerebral edema. Plasma expanders means albumin, dextron in case of hypovolemic shock or the burns. So we had to know about the different types of IV fluids, and we had to know about the pediatric calculations, and sometimes they will ask the plasma expanders images. What is this? You have to name it like that. They will ask, and how to manage. In case of management of fluid overload, we had to manage. How to manage mean we have to balance, fluid balance. Daily fluid requirement for an adult is 30 to 40 ml per kg per body weight per day. Okay, and we have to know about the urine output. Why means we have to balance the fluid levels in our body. In urine output, it is about 0.5 ml per kg per hour. So based on the normal values, we have to know whether there is any deficit or there is a overload. In case of the deficit means what are the causes, what are the signs and symptoms, what is the treatment required, we have to know. In case of the fluid overload, we have to know the causes, signs and symptoms, and the treatment. In case of the pediatric fluid maintenance, we have to use the 4-to-1 rule. What do you mean by 4-to-1 rule? 4 means 4 ml per kg per hour for first 10 kgs. 2 means 2 ml per kg per hour for the next 10 kgs. Then 1 ml per kg per hour for every kg about 20 kgs. Like that, we have to calculate the pediatric fluid maintenance by using this rule. So we have to thorough about the types of fluids, calculations, images related to the fluids, and fluid deficit and the fluid overload management. Next important topic is ABG analysis. What do you mean by ABG? Arterial blood gas analysis. Generally, it is a diagnostic test used to measure the oxygenation and carbon dioxide, blood pH, and bicarbonate levels in the arterial blood. So from this topic, they mainly focus the questions related to normal ABG values, acid-base imbalances, and their interpretations. For example, acid-base means based on the pH, we have to know about the acidosis or the alkalosis. In case of the respiratory acidosis, what will happen? The pH acidosis means here only it is there. pH is low. If in respiratory acidosis, pH is low and PCOT will be rise. In case of alkalosis, respiratory alkalosis, the pH is more and the PaCO2 is low. In case of metabolic acidosis, pH is low and bicarb levels also low. In case of metabolic alkalosis, pH and bicarb levels will be more. So based on the values of the patient ABG levels, we have to know whether the patient is in the normal range or whether the patient is undergoing any any acidosis or alkalosis state. And we have to know about what are the causes, whether it is acidosis, alkalosis or respiratory or metabolic. We have to know about the what are the causes and how do we management. In case of respiratory acidosis means what we will do, oxygenation will be, oxygen support will be there, ventilation support. In case of alkalosis means we have to make the patient to breathe into the paper bag or we will sedate the patient. In case of metabolic acidosis, we have to administer the IV bicarbonate and fluids. In case of metabolic alkalosis, we will administer the IV fluids and the potassium supplements. And next, more important also, we have to know whether the patient is going uses any compensatory mechanism, means respiratory, renal and fully or partially compensated or not. We have to know based on the ABG analysis. Before the ABG procedure, we have to perform a test. That test we call it as a Allen test. Nowadays we are using the modified Allen test, and we have to know which site is best for the collection of ABG. Generally, radial artery is preferred, and we have to know about the transportation time. Means after the ABG, means we will draw the blood, we have to transport with using the ice pack within 15 minutes. And we already know about here the topic is acidosis both in respiratory and the metabolic, alkalosis both in respiratory and the metabolic. Next most important topic is emergency drugs and its uses and its the contraindications also. We have to learn each drug and what is the initial dose and what is the maintenance dose and what are these uses and what are the contraindications also we had to learn. And we also have to learn the images also. Sometimes they will ask the images also related to the drugs. Next topic is ECG placement. When you analyze the NORCET 6 and 7, two questions compulsorily from the ECG. One is from the ECG placement and one is from the ECG abnormalities at the normal. Okay, so you have to focus mainly on the placements and the normal and abnormal ECG. ECG placement, ECG leads. What do you mean by leads? These are the electrical. ECG leads mainly help in the electrical recording of the heart activities from the different angles. In that, so many types are there. There are mainly two types are there. First one is limb leads and second one is the chest leads. Limb leads means it mainly record the electrical activity of the heart in the frontal plane. Frontal means vertical plane. In that, mainly 6 leads will be there. These 6 leads also divided into two types, bipolar leads and the augmented unipolar leads. Bipolar means the name itself is there. It measures the electrical activity from the two different angles and measure the difference between the two sides, lead 1, lead 2 and the lead 3. For example, when we consider the lead 1, it will measure the electrical difference activity from the left between right arm and the left arm. When we come to lead 2, it measures the electrical difference from the left arm to the left leg. When coming to the third lead, it also measures the electrical activity from the right arm to the left leg. Like that, it will measures the difference activity of the between two leads. And augmented unipolar leads, that is AVR, AVL and AVF. AVR means augmented vector right and augmented vector left, and the F means foot. Precordial or the chest leads. It records the electrical activity of the heart in the horizontal plane. Next, coming to the normal ECG values. Means in that you have to know about the what is the interval of the P wave, what is the interval for the PR interval, QRS complex, what is the time for the QR interval and ST segment. We have to learn each value because nowadays they will ask for the duration of the P wave, duration of PR interval, like that they will ask. So what is the duration of P wave? It is about 0.06 to 0.12 seconds. For PR interval, the duration is about 0.12 to 0.2 seconds. For QRS complex, the duration is about 0.06 to 0.10 seconds. In QT interval, the duration is about 0.36 to 0.44 seconds. In ST segment, it is about the flat, and this is about the normal ECG wave durations. In case of the abnormalities also, we have to know abnormalities of the ECG. What are the abnormalities? Bradycardia, tachycardia, atrial fibrillation, different types of heart block, ST elevation, ST depression, T wave insertion, and tall peak T waves. We have to know what are the causes for these type of abnormalities, what are the changes in the ECG. We have to know. For example, if no P waves are there, if no P waves are present in the ECG, it indicates the atrial fibrillation. If the PR interval is prolonged, it indicates the heart block. In the heart block also, three types are there: first degree heart block, second degree heart block, and the third degree heart block. In case ST waves are elevated, ST segment, it indicates the myocardial infarction. If ST waves depression, coronary artery disease is there. T wave inversion is there, myocardial infarction. If tall peak T waves are there, kidney failure. Like that, abnormalities are also there. We have to learn about the normal and abnormalities in the ECG and what are the causes. And sometimes they will ask the questions related to leads to localize the MI. So once you check this one, for example, inferior MI. Inferior MI means inferior or means we already know that is from the downwards, means lower side of the inferior part of the heart. How to recognize based on the leads? Based on the leads 2, 3 and AVF, and septal means here leads 1 and the V1 and the V2. Anterior means here see. This is anterior portion. That's why V3 and the V4. In case of the lateral means we have to know about the V5, V6, AVL and the lead 1. These are the leads to localize the MI. And we had also know different types of the images. Sometimes they will ask in the NORCET series. Sometimes they will show the disease condition or the patient picture, and they will ask to remember which disease condition this is. So we have to know about the different types of the disease conditions. Next, canalization. In the canalizations, there are two types: are the central canalization and the peripheral venous canalization. In the central venous axis means centrally the cannula will be present. A catheter is inserted into the large central vein. Actually, sometimes it will be internal jugular or subclavian or the femoral for administering the different types of medications, fluids, and also for the monitoring of the central venous pressure. So we have to know about this topic thoroughly. What is its location? What are the duration? What is the use of the central catheters? And what are the types? There are different types of catheters are there. What are the types? There are non-tunneled catheter, mainly for the short-term duration. For example, if the patient needs short-term need of the medications, fluids or measuring the CVP, we will use the non-tunneled central catheter. In case of the long-term, means for example dialysis, we will use the tunneled catheters. So next one is third one, peripherally inserted central catheter, PICC. It is mainly for the medium term, mainly used for the EPN and the antibiotics. And fourth type is implantable port. It is for the long term, mainly for the chemotherapy purpose. So we have to know the what are the different type of the central venous access catheters. So four types are there: non-tunneled, tunneled, peripherally inserted central catheter and implantable port. We have to know about the complications. What are the complications? Pneumothorax and the hemothorax, and so many types of complications are also there. And we have to know about the CVP monitoring. CVP means central venous pressure. The normal range is about 2 to 8 mm Hg. In case of the high CVP means due to fluid overload is present or right-sided heart failure. Low CVP indicates dehydration. So now we are using these catheters means we have to follow the flushing also. In the flushing, we will use different types of the methods. What are the different types of methods means in case of non-tunneled catheters means short-term purpose is said na, we will use normal saline or heparin every 8 to 12 hours if not in use means. In case of tunneled catheters, we will use the heparin 10 to 100 units per ml. Weekly we will use. In case of PICC lines, we will use NS or heparin after each use. For this only we have to use the 10 ml syringe. We will not use any 5 ml or 2 ml syringe for these flushing methods. In case of port means implantable port means we have to use heparin 100 units per ml every 4 weeks if not in use. Okay, and we also have to know about the technique. What are the technique means push pass or start stop technique. Means we have to flush with, first we have to flush with 10 ml in a stop start manner. Okay. Only in case of the port we have to use the positive pressure technique in order to prevent the blood reflex. Okay. The flush sequence will be commonly used is SASH. SASH means first we have to saline administer, we have to give, then medication, then saline. In if necessary means we have to use the heparin. Next one is peripheral catheter. Peripheral canalization. In peripheral cannula means we already know. We have to know about the different sizes or different cannula sizes, and the gauge will be there starting from 14, 16, 18, 20, 20 to 24. And color codings also know. We have to know before the examination. And extravasation means extravasation and phlebitis also we have to know. And next topic is oxygen administration types, mask. What are the masks we have to use while giving administration of the oxygen? What are the types? So many types are there. In this, low flow oxygen mask will be there, simple face mask, partial mask will be there, non breather mask is also available. And while knowing the mask, we have to know about the flow rate. For example, low flow oxygen, it only deliver the 1 to 6 liters of oxygen per minute. And we also have to know about the FiO2 also we have to know. And in case of the high flow mask means Venturi mask, high flow nasal cannula and the aerosol. In mechanical ventilation, we will use the CPAP, BiPAP and the amber bag. Like that, so many types of the oxygen administration mask we have to know, and the types also we have to know. Coming to the CPAP and the BiPAP. What do you mean by CPAP? C means continuous positive airway pressure. BiPAP means bi-level positive airway pressure. CPAP means it is a airway pressure, provides a continuous level of positive airway pressure throughout the active and entire breathing cycle. So we have to know about the indications, and we have to set the settings also for that. What is the pressure? We have to maintain a pressure of 5 to 15, and FiO2 is about the 21 to 100%. And we have to ask different types of mask for the CPAP. Generally, nasal full mask will be we have to use. And BiPAP. BiPAP means bi-level positive airway pressure. It delivers two types of pressures at two different levels. During the inspiration or inhalation, it will use the high pressure, and low pressure during the exhalation. So we have to know about the pressure in the inhalation. It is about the 10 to 20, and the pressure during the exhalation is about the 4 to 10. And we have to know about the indications also we have to know. So we have to know complete about the CPAP, BiPAP and ventilator settings. Ventilator settings means ventilatory modes will be there. Basic modes are controlled mechanical ventilation, assistant controlled ventilation, synchronized intermittent mandatory ventilation, pressure support ventilation, positive and expiratory pressure. Like that, we have to know about the each mode, and we have to know about the each mode independently. And the tidal volume, respiratory rate, FiO2, positive end pressure, peak inspiratory pressures also we have to know while setting the ventilator. Next, other topics is trial tube procedure, feeding positions. Up to this topic means up to oxygen, these are the most important topics. So we will deal do only important points. But remaining topics they are asking, but not that much frequently. But they will ask in one paper like that. So only we will mention the names, trial tube procedure and the feeding position, and the questions related to the Foley's catheter and its sizes, color, codings, and the care to prevent the COTI. COTI means catheter associated urinary tract infections. And we have to know about the different size for the newborn, infant, children, and the adults. Next one, we have to know about the common types of HI. HI means hospital acquired infections. In that, it is mainly divided into COTI. COTI means catheter associated urinary tract infections, surgical site infections, and CLABSI, and the VAP, ventricular associated pneumonia. What are the causes? What are the signs and symptoms? What are the preventive measures to prevent the hospital acquired infections? We have to know. Next, we have to thorough about the TPN. TPN means total parental nutrition. What are the indications? What are the the contraindications, what are the side effects, and how we will administer the TPN also we have to know. Next one is about the types of shocks and its management. There are different types of the shocks and different types of the management also is there. What are the types? Hypovolemic shock, distributive shock, cardiogenic shock, obstructive shock, anaphylactic shock. We have to know the difference between each shock, and we have to know the causes, signs and symptoms, and the management we have to focus. Next important topic is antidotes. Antidote means if any case or in case of any poisoning, means overdosage of any drugs, it will lead to the poisoning, and we have to know about the antidotes for that particular poisoning. Next topics are hand hygiene and what are the universal precautions. Thoracosynthesis, parasynthesis, like that procedures also they will focus to questions. Infusion pumps, triage. Next most important pediatric topics are normal blood values, CPR and the drugs used in the CPR for pediatrics, images related to the different congenital abnormalities, vitamin deficiency, conjunctivitis, different types of reflexes, preterm related questions, growth charts, low birth weight and its management, different types of vaccines and types of administration, types of feeding, nephrotic syndrome, ADHD, and all the emergency conditions and its management. These are the most important topics frequently asked related to the pediatrics. Coming to the obesity topics, mainly it is focused on the delivery time and images related to the placenta, like that only asking. In the obesity topics, they are mainly focused upon signs of pregnancy, stages of delivery, maneuvers, ultrasound images and for the abnormalities and the normal, placenta normal and abnormalities, and images also. Type of discharges, umbilical cord normal and abnormalities, cardiotocograph, fetal circulation, kangaroo mother care, breastfeed techniques, and the complementary feedings. These are the most important topics. Mainly they are asking the questions maximum from these topics only. Next, coming to the community health nursing. Mainly they will focus on the new schemes and the contraceptives. In this also we also focus about the different types of communicable diseases, modes of disease transmissions and level of prevention. Communicable diseases means we already know tuberculosis, HIV, AIDS, malaria, dengue, leprosy, COVID-19, hepatitis, like that every communicable diseases we have to know. We have to know about the causes, signs and symptoms, incubation period, and the preventive measures. And next topic is family and maternal childhood nursing. In that they will mainly focus on the antenatal, intranatal, postnatal care, and most important is immunization schedule and the high risk pregnancy, maternal mortality, morbidity rates, family planning methods, natural and the modern contraceptives, immunization techniques, cold chain maintenance, referral system, and the programs related to the national health programs and the policies, universal health coverage and Ayushman Bharat scheme, national disease control programs, that is RNTCP and NVBDCP means National Vector Borne Disease Control Program, National Leprosy Eradication Program, Non-Communicable Disease Programs, and Reproductive and Child Health Care Programs. These are the most important topics from which different types of questions are asked in previous NORCET series. Coming to the psychiatry. Theories and models of mental health nursing, psychoanalytic theory, Erikson psychosocial theory, cognitive behavioral theory, humanistic theories. Different types of mental disorders and their management. The main most important topics related to disorders of the mood and emotion, schizophrenia, anxiety, stress and somatoform disorders, neurodevelopmental and child disorders, neurocognitive disorders, eating disorders, personality and behavior disorders, substance use and addictive disorders. And also the questions related to the psychopharmacology in psychiatry, psychiatric emergencies, and the psychotherapies and alternative treatments. In psychiatry, they will ask mainly sometimes 4 to 5 questions. One is related to therapies, one is related to images or the medicine related question, and one is from the signs and symptoms, and one is from the emergencies, psychiatric emergencies. So if you are thorough these topics, you will surely get the 5 marks. And last most important is research. In this research, the main questions are focused on the research approaches in nursing, either qualitative and the quantitative, ethics, review of literature, hypothesis, and the variables. Different types of research designs, experimental, non-experimental, survey, case studies, action research, epidemiological research, and what are the different types of sampling methods, data collection methods, everything they will focus. In research also, sometimes they will ask so many questions from the research. Mainly, these are the most important topics what we had dealt today. From this, 80% to 90% questions will be there. So before the examination, focus these topics and focus what are the topics dealt today means you will get a sure success. So once again, check what are the topics needed for the examinations and prepare well. We will explain each topic separately in the next videos. Thank you.